Hey guys, all right. Today we're going to start discussing a little bit about how channels work. I notice a lot with my students that they graduate without a clear sense of exactly, how do these channels relate to these organs and all that. So let's just give a very sort of brief and concise introduction. This is not meant to be comprehensive by any stretch. But let's say this. So the basics starts like this. When the organ is somehow full, let's say heat, right? So the organ is full of heat. It actually kicks that heat off to the yang organ. Then when the yang organ is healthy, it kicks that heat off to the yang channel. Okay. And again, this is not the only way that heat from an organ can go, but let's just be simple today. So let's give an example then. Liver heat, very common thing to see in the clinic. So liver heat then, and what we would want to see, what happens here is we say, okay, when somebody has liver heat, it kicks its heat off to the gallbladder organ, and when the gallbladder organ's healthy, when the body is generally healthy, it kicks that heat off to the gallbladder channel. Okay, so let's give the example of this. Could be things like a alcoholic or something. So it's like liver excess heat, and then so the gallbladder gets hot, and then the channel gets hot. But then eventually, once the channel loses its ability to disperse that heat properly, then it backs up into the gallbladder organ. And then you start having gallbladder problems, and when the gallbladder is full of heat and can't kick that heat off anymore, that problem starts to back up into the liver, and now you're getting like cirrhosis or something, right? Okay, but let's discuss something that I see far more often than that, which is liver yin deficiency. Okay, so let's just give this one very simple example. Again, there are many directions that this heat could go, actually, in reality. So it can go, we're saying, okay, liver organ to gallbladder channel, but it could go straight from the liver to the liver channel. So like an organ channel relationship, or it gets out to the gallbladder channel and starts spilling out into the Sanjiao channel, or it could do a midday midnight thing, or you could get it where the liver heat starts getting into the spleen and stomach. Now you're getting heat in the stomach channel and the gallbladder channel, and that's could be like sometimes a Wendantang pattern or something like that, right? Okay, but let's just keep it simple today. Liver yin deficiency, heat builds up, goes out to the gallbladder organ. Gallbladder organ kicks that heat off to the gallbladder channel. Okay. So typical liver yin deficiency symptoms that we're sort of used to thinking about with TCM is like vision issues, blurred and vision, numbness of the limbs, tingling, amenorrhea, scanty menstruation, dull, like pale skin, complexion. You start getting muscular issues. You start getting, joint issues, tendon issues, weakness issues, injuries and that kind of thing. That all sounds like blood deficiency, right? But then what is yin deficiency? Yin deficiency is just blood deficiency, but worse, and you add heat symptoms. Right, so this is kind of the standard sort of TCM way of thinking about it, and this still holds true. So that then you start adding symptoms like irritability, insomnia issues, especially dreaming and that kind of thing, headaches, that kind of stuff. It starts to be that indication that there's actually heat in there, and these are all sort of organ diagnostics typically. But what about then getting into channel diagnostics more specifically? Although, to be honest, some of these are sort of, in a sense, channel diagnostics. But let's be more specific. So things like IT band issues. So a really classic way to know. So you're talking to the patient, and the patient starts describing symptoms consistent with liver yin deficiency. So you lay them down, you want to start palpating, you want to see how, kind of how far has this heat gotten out into the body. You're sort of starting to track symptoms. They're telling you about different symptoms. You're like, okay, what's going on here? You start palpating. So if there is liver yin deficiency, then you palpate the IT band. And it's really typical in patients that they'll have a tight IT band. And this tightness of the IT band just under your fingers will indicate this blood deficiency. But then if the patient says that the palpation it's tender on palpation, or it's somehow painful, that would be more indicative of there being heat there. And it may even be warm to the touch. That particular area, for some reason, just hotter or warmer than the other areas of the thigh. This may be possible, indicating there is this heat there. And then there's needle techniques for sort of kind of clearing that heat out of the channel a bit. Things we can talk about later. Then, what else? Heat, so it rises, so you could go up the channel, like rib side distension, maybe. Somewhat more indicative of just sort of chi stagnation, but still along the track of the gallbladder. When people want to stretch, they stretch sort of side to side to relieve that rib side distension, right? You get things like shoulder issues, maybe. And again, this could be just in a general way, just blood deficiency, right? So the shoulder, we don't have to think of it as being connected to the channel. We could think of it just as, the shoulder relates to the liver, right? The 50-year-old shoulder. So if somebody turns 50, they start having shoulder issues. In the literature, this is indicative of now there's a more significant level of blood deficiency, and it's a typical, age in which to get those kinds of injuries. And this is well, you guys know this issue, or this concept called the hollows. The hollows is the different joints related to the different organs. So we already know the kidneys, right? So that's the low back and the knees are the hollows of the kidneys. And so, yin deficiency heat of the kidneys, it gets trapped in the knees. It gets trapped in the low back, along the trajectory of the urinary bladder channel. So that kidney deficiency heat's getting kicked out to the urinary bladder channel. And it's going to tend to get caught in the joints, which is typical, but especially the knees and the low back. For some reason, those are areas specific to the kidneys. This also explains things like occipital headaches, very commonly due to kidney yin deficiency. It's that heat getting trapped in the joint there, in the trajectory of the urinary bladder channel. Okay, the shoulders are, of course, then the hollows of the liver, we say. What am I missing here? Oh, the hips then are the hollows of the spleen. And this shows up, where you see this a lot is in pediatrics, where kids get hip dysplasia, where the hip is not holding into the joint well, and then they'll do double diapering or something like that to try to hold it in while the child grows. And ultimately, if it's bad enough, there's surgery or something. But if you just do spleen tonics, give the kids spleen tonics with lots and lots of stimulation, kind of manual stimulation in the hip area, that'll correct that pretty quick. But again, this is telling. Where you see this too is in your geriatrics patients when they get hip injuries. A patient falls and breaks their hip. That's not good if they're older. So a lot of the times we're thinking, a bone, and so let's give them kidney tonics, right? But in fact, you find spleen tonics is kind of what you need in that situation. It'll heal it up a lot faster. So hollows there. Then you have the heart and lung kind of share the neck, in fact. And what you'll see in some traditions is anytime there's a neck issue, you can needle the lung channel of the forearm, or maybe the large intestine channel of the forearm. Like if you get a patient who comes in and they have a kink in their neck and they can't move and it's really uncomfortable, right? Well, you can palpate along the lung channel of the forearm, lung 6 area and all up and down there, and find a tender point. And if it's tender, then have them go through the range of motion, as limited as it is, just to see, sort of objectively. Then find the tender spot, needle that, or you could use like a contact needling or something like that. But typical Chinese style would be to needle it with insertion needling, and then manipulate the needle until the patient feels some kind of sensation, and then ask them to rotate their head again. And often they get more range of motion out of that. So then you could do the same thing again on the same point, just leave the needle in there and keep manipulating it. You could do this 4 or 5 times. And as long as they keep improving, actually, you can just keep doing it. But if at some point they kind of stop improving, you can go and find other spots. So just in this situation where we're talking about the hollows, then the lung organ, you could try this is typically the heart organ, you could try the large intestine channel of the forearm. But because the heart seems to relate to this as well, you could check the heart and small intestine channel of the forearm as well, and this would be possible. So this concept of the hollows. Anyways, so the this yin deficiency heat of the liver may be getting into the shoulders, causing pain. Okay, getting sort of trapped in the joint there. Going up the channel. Another area that I really like to check with palpation for this exact situation is the scalenes. In blood deficiency, constitutional or pathological, liver blood deficiency, the scalenes are often tight, downright ropey for some people. And on palpation, you feel that it's firm and hard and ropey, then okay, fine, that's, just blood deficiency. But if then it's also tender for the patient, even painful on palpation, and sometimes they'll even describe kind of a nervy sensation, almost like an electrical kind of shooting sensation out of there. Very common. That's that heat kind of moving out as you palpate into that area. So I really like checking the scalenes as well to get a sense of that. And you could come in there and again do contact needling, light gua sha in that area, and often those people, it's a lot of sha comes up in that situation. What else? Going further up, then you would have, a really common symptom here is like a clenching, grinding of the teeth, leading to TMJ issues. So at night when they're sleeping, they'll be clenching, grinding, and it's very common to see this, they're in bite guard and all that. So this is a situation where then this liver yin deficiency heat is getting kicked out to the gallbladder channel, and it's getting stuck in the joints. In this case, the joint, the jaw there, right? That joint. So so like that. Okay. Where else? Into the ear it can go, and then that's you get like tinnitus. And some people will say, oh, for liver tinnitus, it tends to be more high-pitched kind of sound, whereas maybe kidney will tend to be low-pitched, so, and that does seem to bear truth in my clinic. I noticed that. Then you get a little further up, I guess you get into like temporal headaches, right? And I almost think of, because the skull is a bunch of bones knitted together, it's like a joint in a way, and it's almost like a little hollow, the temporal side of the skull there. So anyways, this is this notion then that you sort of have a list of symptoms associated with liver organ kind of yin deficiency symptoms, stuff we're used to thinking about through the TCM herbal training, right? So then you're thinking about your formulas and Then you have to think about, well, then what constitutes in this situation a channel symptom? So here what we've done is we've broken down the difference in a sense between sort of organ symptoms and then sort of channel symptoms in some general way. So this is sort of the thing. So then this goes for all the organs and all the channels. And like I said, there's a lot here. Just liver yin deficiency heat can go in a lot of areas. We've just talked about one. But it can go, it's almost, in a sense, it's almost kind of infinite where they could go. What's nice, though, is that there's a tendency, the liver heat's going to get kicked out eventually to the gallbladder channel. And that's the first place it's going to go. So that's the first place you can look. Other areas get, like midday, midnight, it's a little more exotic. So it's not quite as often, but often enough. So it pays to kind of learn all these things. So anyway, this is just a simple thing. So in that sense, then what about treatment in this case? So at least in the acupuncture style that I study in, they would use liver 8 and kidney 10. Okay, these are water points, and in this case, liver 8, and this is the same is true for TCM when they talk about liver 8. It's a blood tonic, a yin tonic for the liver, and the explanation given here is that water points are going to tend to draw fluids back into their respective organs, right? So that kind of fits for the use of liver 8 and kidney 10 if you can find them. Then a nice point to add here, if it's tender, is then spleen 9. And this is where probably the water point logic diverges a little bit from TCM, because usually we're using spleen 9 as a way to drain dampness out of the body. It's typical. But we talked about that, remember, before, with spleen 5 kind of being that point because of that acridity, that spiciness, sort of drying out or maybe moving dampness depending on your perspective. So here, then, in this case, spleen 9 being a water point, it actually activates the spleen's function of putting that postnatal fluid, postnatal blood, postnatal yin back into the system. So you're actually sort of activating that function. And look, typically, if there's liver yin deficiency and it's strong enough, liver 8's going to be tender, kidney 10's very likely to be tender, and spleen 9 is also quite likely to be tender. In which case, I'll needle all three. And it's a yin deficiency thing. Those are C points, so you can use a little bit deeper insertion. You can use more retention and the like. As far as the gallbladder channel symptoms, we already talked about a few little treatments for certain areas, but this is a situation where you want to use, probably the gallbladder, the part of the gallbladder that's on the foot, sort of treat the opposite end of the channel. And so you get into points like gallbladder maybe 43 for more like temporal headaches, maybe, sort of the forehead area-ish. Or that area of the head, that level of the head. Then going further down, you're starting to get into the ears, into the eyes, into the jaw and stuff, maybe gallbladder 42 and 41. So you're sort of going further down. And if it's more in the neck, then in theory, more gallbladder 40, right? The ankle being the neck in this situation. But what you'll do is all of these points you'll want to palpate and get feedback from the patient. Is that tender for you? You might feel that the point is actually warm under your finger. You may feel that the point has a firmness that you don't expect, or like these kinds of findings might be indicative of the idea that there's heat. And so what's happening here then is the heat is then getting trapped in sort of the area of the channel that kind of mirrors the area of the body where the problem is. So you get a problem in the jaw, that's somewhere between the neck and the top of the head. So if it's top of the head, that's like gallbladder 44. If it's the neck, then it's gallbladder 40. So somewhere in between there, you start kind of palpate points to see, So like I said, 41, 42, 43, these are all fair game for this. And look, typically one of those three is going to be tender, and you can needle that. And then that'll sort of, that sort of, it's the mirror of the area where the actual symptom is. And so then in that case, it's kind of like you're sort of clearing that blockage. And so by clearing the blockage on one side of the channel, in this case in the foot, then you're sort of clearing the symptom on the other side of the channel in the head, where the symptoms typically are, because heat rises, right? So if you're lucky enough that the patient comes in and they're having the symptom in question, or one of the symptoms in question indicative of, related to whatever their chief complaint is, then you could actually needle, 41, 42, 43, and see if you can get that pain to go down while they're on the table, a la the style that we talked about when we were talking about menstrual pain, right? So this is a basic introduction to sort of how channels work. This is very basic. It doesn't describe all of the different directions that different pathologies can go. There's, like I said, almost an infinite number of directions, but this being the most common, it's worth just fleshing this out a little bit. The yin organ to the yang organ to the yang channel. This is by far the most common direction that this heat is going to tend to go. Now, if there's enough of it and it's been going on long enough, guaranteed it's spilling out into other areas, it's affecting other organs, so you're going to have a job on your hands here. But just in a very simple way, this is how you start unpacking this a little bit, the relationship of organs to channels. Okay? All right, guys? Sounds okay? Okay, take it easy, huh?